Medication reconciliation is actually a foundational process. It involves all members of the staff and healthcare teams. It is a description of a way of making sure that the medications a patient is prescribed are the way the medications are being taken. Well, there are many different ways that you can do it, and some of the key points are having your patients either bring in their medications, actually bring the bottles in for reconciliation, or bring in a medication list. Every visit, not just for a physical or a diabetic visit, every time you interact with a patient, your patient care staff needs to review every medication, not just once a year or once every 6 months, every single visit. Medication reconciliation helps with decreasing the cost of care. Patients are not admitted for medication errors. It decreases refill requests. It's a safety issue for patients. It's a huge patient satisfier when they know that their entire care team is watching them and helping them to reconcile their meds so that they're getting the right medication, the right time, the right dose. The very first thing is you need to meet with all of your patient care staff to make sure that they understand what it is, that they're clear on the process for documenting in the electronic medical record, and plan retraining if you need to do that. We have all of our schedulers ask patients to actually bring their medications in. Some of the CMI clinics are giving patients a medication record, what we have listed as their current med when they check in. So there are some other ways that you can work with your teams to teach them how to get everyone involved in this process. We actually did a week of med reconciliation focus at our clinic, and we made it a fun week. We had games, we had trivia, we had lunch and learns, and we had root beer floats and things like that, to make it a fun thing to remind people. And then once the process was again reestablished, the expectations were set, then as a nursing supervisor, I worked with individual staff members to room with them, to do med rec with them, to make sure that they were involved in the process, understood the process, understood why it was so important, and also physically how to do it in the electronic medical record. On the CMI website, there are tools for how to re-educate your staff. There are some wonderful PowerPoint presentations, from one that's almost an hour to one that's about 15 minutes that we used at a lunch and learn. On the EPIC site that has EPIC Education, there is the section that involves medication reconciliation, which clearly delineates the process and how it's documented in an electronic medical record. Well, medication reconciliation is an integral part of our electronic medical record. We use EPIC here. There is a standard workflow for the EPIC system for patient care staff who are rooming. Part of that standard workflow is medication reconciliation. It's documented. There is a documented process on how to do it. A lot of information in our system. So before clinics even start to move to the CMI model, they need to make sure that they have these foundational things in place. And I think most clinics will be very surprised when they see that they're actually already doing it. They're just not focusing on it. And it's wonderful because everyone's ideas are heard, no matter how big or how small, and everyone's empowered to have these ideas. And we use that word a lot, I think, in corporate and healthcare empowered. We use it a lot when people really aren't, and I think you'll find in the CMI clinics people really are, and it's very exciting. So there's a lot of passion around it.